Back from commercial break, you've got Alan Edwards being joined by the famed dentist from Des Moines, Mel Garrison. Dr. Garrison, how in the heck are you?
Doing very well, Alan. Thanks for having me tonight.
Great to have you here. We've jumped right into the action, and today we're viewing Dr. Minth, and he appears to be performing a Class 2 direct restoration. And it looks like we've moved into the anesthetic portion of the early part of the procedure here. Just exactly, is he using Novocaine?
That's called Articaine, a newer generation, very similar to Novocaine. Articaine will filter through the bone much better than the old Novocaine will, much less reactive, less chance of a patient having an allergic reaction.
It's clear the patient seems to be without pain and is quite comfortable here, and I guess that's the goal of the anesthetic.
Exactly. I want to remind the viewers that Dr. Minth's assistant, Mariana, had already placed the topical anesthetic. So between the topical anesthetic, a very short 30-gauge needle, and Dr. Minth's technique, patient felt very little or no pain.
All right, what looks like we've got a little conversation taking place here between Dr. Minth and his assistant. What do you think they're talking about?
Well, you know, they work well together, and they're probably just joking with each other.
Is it a spoken language, or is it pretty much unspoken at this point in time for these
It's a spoken language, not for the patient, though. Obviously, the patient has to keep their mouth open. And Dr. Minth is careful to ask only yes-no questions. You can't be asking questions about their family life while they've got their mouth wide open.
All right, so tell us a little bit about what he has just completed here. Looked like he used a fish hook in the patient's mouth.
That's called an explorer, Alan.
Gotcha. What is this? We have come a long way. It looks like one of the ways that you stay happy during your procedure is to be able to watch your TV show of choice while the work is being done.
Obviously, the show of choices now is to watch the Olympics, and there is the patient watching Dr. Minth's fellow American competitors in the beach volleyball competition.
You think they go home and watch him perform his dental Olympics? You think they recorded this today?
I would think so. You know, athletes, they respect other athletes.
I'm quite sure they did. We know that Dr. Minth couldn't go out on the volleyball court, at least not now, and I'm quite sure that we wouldn't want the volleyball players in the operatory.
No, not at all. No, bad idea.
All right, it looks like we're seeing some foot action here from Dr. Minth, and this is where the real skill set comes into play. Most people don't realize that Dr. Minth is also a musician. Looks like he's pumping the bass pedal here.
That's right, he's using his heel, which I find a little bit strange. I figure most dentists would use their toe, just like an acceleration pedal in the car.
All right, and what exactly does this help Dr. Minth do during the procedure?
This is like the gas pedal for his handpiece. He can adjust the speed of the handpiece, fast or slow.
I wonder if he drives his car with his heel. All right, it appears that Dr. Minth has chosen to go with the low speed. Why would he switch over here from the high speed?
Well, this is unexpected. I know that Dr. Minth usually prefers the number 6 round burr. He picked up a 4 round burr, a little bit smaller. I'm assuming he's trying to be conservative and keep the preparation as small as possible. He wants to preserve as much of the natural tooth structure as possible.
I think that's an important quality to have as a dentist. Let's not go in and create more work for ourselves, but go in and create something that's going to cost more for the patient.
That's right. In dentistry, our job is to make our job obsolete.
Let's hope that doesn't happen. We hope to be able to enjoy Dr. Minth in the Dental Olympics for a long time to come. Tell you, one of my favorite movies is Back to the Future, Dr. Garrison, and it looks like I see the flux capacitor in the background there. Tell me just exactly what that is.
No, I'm afraid that's the monitor for the nitrous oxide. Dr. Minth's patients don't use nitrous oxide very often, don't really need it. He's that good.
That's something that looks like it's empty. Empty because it doesn't need to be used. I believe we just caught a glimpse at the preferred footwear of Dr. Minth, and I believe I saw a pair of skateboard shoes. What do you know about that, Dr. Garrison?
Well, I talked to Dr. Minth before the competition, and he was an amateur skateboarder growing up.
I think he made a wise decision by moving into dentistry. He probably saved himself some future visits to the ER dentist.
That's true. It is a lot easier on the knees, isn't it, Alan?
Absolutely. Well, I wouldn't know. So what do you think are the most common events that we would see in the Dental Olympics? Is it similar to the most common events or cases that a clinician would see in practice?
Very much so. This is the Class 2 direct restoration. Direct meaning they place the filling directly on the tooth, where the fixed prosthodontics would be an indirect restoration, meaning the restoration would be made outside the mouth, then cemented in at a separate point.
Dr. Garrison, when you competed in the Dental Olympics, did you wear spandex, and when did they switch over to the scrub uniform?
Well, I had to wear a suit and tie back in my day with a white coat.
Okay, well, I think those changes are good.
Those changes are good, Alan. You weren't able to disinfect that tie and couldn't wash it. Knowing that that bacteria is right up against your chin every day, it got disgusting.
All right, this is my favorite part of the procedure. It looks like the etching has begun. Tell us a little bit about what Mariana and Dr. Minth are up to.
That's correct, Alan. This is the etching procedure. That's an acid etch, much like etched glass. It roughens the surface of the enamel, get better bonding for the filling.
So if we're etching glass here, could Dr. Minth put his initials there in the patient's teeth?
He could if they would like that.
This process is moving very quickly, which I'm sure the patient is highly appreciative of.
Look in his eyes. That is focus. That is focus.
Well, that's why you're the dentist and I'm simply the commentator, because I can't even see Dr. Minth's eyes. Not sure what to expect here today, Dr. Garrison, from Dr. Minth. You know, he spent the last evening out with the swim team, and I think they got themselves in a little bit of a pickle there in Rio.
A little bit, I would say.
Give me a bit about what was just used there. It looked like he was using a hairdryer on the patient's mouth.
What that is a high-intensity curing lamp is what we call it. It has to be a specific wavelength of blue to cure the filling. As a matter of fact, some of the filling materials we put out, and you can shine a laser light on that laser pointer on it, and it won't cure. It has to be that specific color of blue.
So it's helping it dry faster. Is that correct?
Yes, roughly 30 to 40 seconds. Some of the newer lights are much faster than that.
I sure wish the painters that just painted the addition to our house would have used an instrument like that to help the paint dry a little sooner. Would it work there?
I don't know about that, Alan.
All right, what's going on right now?
Looks like he's polishing the filling. They've already done the adjustments. Check the bite to make sure that it's not interfering with the lower teeth when he bites down. So just doing the polishing to shine it up, make it as smooth as possible.
This is really the latter stage of the procedure, am I right?
This is the final stage. He'll ask the patient if the bite feels good and feels nice and smooth, but this is it.
Oh, he stuck that procedure.
That is beautiful.
That is pure work. That's an Olympian right there for you, folks. That separates the dentist from the non-dentist.
We're talking dentistry. This is not figure skating. This is Olympic dentistry.
I couldn't agree with you more there, Dr. Garrison. You know, there are a number of sports that are no longer a part of the Olympics, but I can almost guarantee you that we'll continue to see this procedure in future dental Olympics to come.
Let's hope so, Alan. And here we have it, the judges' scores. Oh, look at that.
10s across the board.
That is amazing.
When was the last time we saw this?
Back in Munich in 72, I believe.
Yeah, the ophthalmology games.
That's right.
Wow. Big stuff today. Boy, what a special night tonight for Dr. Minth.
Sure has been.
As he takes the gold medal here at the Dental Olympics, he's got to be proud. So Dr. Minth will be bringing home the gold. For Mel Garrison, I'm Alan Edwards. Thank you for joining in to tonight's special coverage of the Dental Olympics. Tune in tomorrow evening as the proctologists get their competition underway. Sure to be full of excitement. We'll see you next time.
Don't like going to the dentist? You're going to the wrong dentist. TheRightDentist.net.